Thanks for joining us today. Here to talk about a portion of the healthcare system you may not know about. And it is involved and affiliated with the Veterans Administration. There is a Veterans Clinic located in Brattleboro. And their medical director, Dr. Richard Orlan, is our guest. Thank you for joining us.
Well, thank you for having me.
So give us the rundown. How long has that clinic been around, and where is it located, and what do you do?
Sure. So the community-based outpatient clinic of the White River Junction VA Health System is located here in Brattleboro. It's off of Exit 1 in the Industrial Park, down right off of US 91. And we've been there now, we're going into our third year. Actually, they celebrated their second anniversary this summer. And we consider ourselves a primary care center on steroids.
My.
We have 5 services that actually are all under one roof, with the primary care service being the main service in the facility.
Fantastic. So who do you serve and what do you do there?
So we serve anyone who served our country. If you were a veteran or affiliated with a veteran, depending upon their situation on discharge from the military, you have right to access the veterans' health benefit system. And it's something that people don't understand. You did not have to have had a physical or a significant mental or emotional illness as a product of your service. On discharge, if you were discharged and had no quote-unquote disability, for years many people felt, and the system may have in the past actually promoted, that we weren't your first choice for health care. But the new VA, I think, has really recognized its responsibility and cares for and will offer care to anyone who served our country or is affiliated with someone that did as appropriate to their discharge condition. So we provide primary care services on site, as I said, but we also have other services that we provide under that roof. And we act as an entree or an access point to the White River Junction Hospital and Medical Center, but also to the National VA Health System. And there is a multitude of programs that are out there that you may start seeing actually advertised on local television and on the radio. It's actually interesting for me because I'm relatively new to the system, and as I listen to local media and I watch the television, which I don't have a lot of time to do, but I see commercials and therefore programs that we're providing services to the community, and it's quite exciting.
So what kinds of services do you provide in Brattleboro, and as an entree to the system, how much do you work with the professionals at the nearby VA hospitals?
Right. So, as we said, we have a primary care setup, which includes the medical director and several nurses, a health technician, and we do blood drawing right there in our facility with the blood work sent up to the White River Junction Hospital for the appropriate testing and analyses. And we do basic primary care services so that people who have chronic illnesses or medical problems that need management come to us. And as in many cases, some of the vets come to us to get their medications, and they still enjoy their relationships with their local primary care providers or specialists. And in some cases, people, even if they don't have to, want to be in the system because they understand the coordinated care and some of the level of expertise that's enjoyed through the affiliation with Dartmouth College and the medical school up there, and we are able to provide that level of service there. We have a home-based primary care group where we have a resident nurse, social worker, and therapist that can come into people's homes that are technically homebound, and we, with the VA physician that's assigned, can provide almost the same level of primary care to people who have difficulty coming physically to the office. And that's very unique to this setup. As healthcare is looked at expanding into the community and medical homes have become the focus and the big initiative, obviously, with the changing in reimbursements, the way the VA has done it and is doing it for years is actually some of the models that they're using for some of the programs that are coming out. We have a resident facility as part of what we do with a mental health component. We have a licensed clinical social worker and an assigned psychiatrist who does both talk therapy as well as prescriptive interventions. And we also take advantage of another program with that program, which is our video telehealth program. And so we're able to do remote interventions via television cameras, TV monitors, and communication devices, both in people's homes as well as located at our facility. The home telehealth program is slowly becoming more sophisticated, but at our facility, some patients can be interviewed or even examined, and they can interact with physicians that are not just up at the White River Junction facility, but even in Boston and in other places. We have another program for the homeless veterans, so that we have a dedicated full-time social worker whose job is basically to interact and provide entree into the health system for people who don't have an address. You know, there are many people, unfortunately, in these times that are suffering with the economic woes that are out there, and we help them find a place to live as well as to get better health care, both for their physical, mental, and emotional needs. So it's kind of a big wraparound service. We give you a big bear hug and kind of bring you in and try to, identify how we can help you be successful.
So why are not more people taking advantage of this system? Do they A, know about you, or B, understand that it may apply to them?
Well, there's a lack of education, and I think in some situations a lack of knowledge. There was some fanfare, obviously, when the facility was opened a couple years ago, and we've had a lot of champions both in the community and in our legislative group. Bernie Sanders and Sam Haskins and the folks that are out there have been very, very helpful to developing and having this center placed in Brattleboro. But I think that people assume, as they do in many situations, that if they didn't lose an arm, or if they didn't get blown up in war, or if they didn't have some significant emotional or mental stress due to their service, that and it was recognized at the time of discharge, that they don't have access to the system, and that's just not the case. If you served our country at some point and your service was recognized, you have the potential to access our benefits. And I think it's just a matter of calling the Veterans Benefits Office, for which we actually are lucky enough to have one of the regional centers right up at White River Junction. And there's some paperwork that can be filled out, and people can find out exactly, what level of benefits that they would be able to access.
So really, it sounds as though the best thing for anybody that has any questions at all should call and try to get a benefit determination.
802-251-2200. That's 802-251-2200. Yeah, so if you call our main number, and usually you'll get Lauren. He's our office supervisor and front desk guru, and he's actually has a wealth of experience in the VA system for many years, and if he can't get you the answer, he'll find out someone who can. And many times, as in anything with the government, there's some papers that have to be filled out or filed, but it's not very usurious. And I think that if people don't find out where they sit in the system, they're neglecting access to very crucial benefits, especially in these economic times.
I was going to say, with healthcare going through the changes it is this something that's being underutilized, or is this a duplication of existing services?
So I think there's a level of sophistication out there. There are some people that have known that they could access the system even if it wasn't needed. There are other people that have had no other choice. And then there's more people that are somewhere in between, that they just don't know that we're there or that they can come through the door. And it's basically that deficit that people don't know. Some people, I tell people I work at the VA, and they ask me how my drive up to White River Junction is every day. So, I mean, there's just a basic knowledge deficit that people don't know we're here. But then the other part is, as yourself, you served the country in some capacity, and you were discharged and you had no service connected or related, issue, and you didn't know until we spoke this morning that you possibly could receive benefits through our system.
Interesting. So really, all that remains is a determination of eligibility for anybody. It's interesting you brought up the White River Junction connection, because back while my dad was alive, he was one of several people who had to go to White River Junction for his veterans' medical care. And that really took a huge chunk of time and money for anybody, especially those who might be on the lower end of the income spectrum. Can a lot of that now be done in Brattleboro?
So again, we act as an access point to the system. There are things that we physically don't do here in Brattleboro. We don't do x-rays on site. We don't do surgeries. We don't do emergency care, but we can triage people and certainly make referrals. And what I make a real attempt to do is to kind of cohort visits and consultations. So, if someone is coming to us and we know they need to have an x-ray and see the podiatrist, or they need new eyeglasses, which is a covered benefit, by the way, at a huge and significant discount, in many cases free, then I try to, when I make a referral, indicate that not only are they coming up for some other reason, but maybe they even need some assistance with transportation. And we do have a local DAV program where there's a van that goes up several days a week on a schedule, so that the system up at White River Junction knows when the van's coming, and we can really try to do a good job in coordinating people's visits and being respectful of their time and their lives.
So who is out there for the veterans population that not only could utilize the service, but frankly could be in need? It sounds like you've got both the aging veterans of the Vietnam and Korean era,
sure.
Plus
World War II, still.
World War II as well. Some may still be with us. Plus, really the big influx we've seen in the past decade from both Iraq and Afghanistan, and we'll get into those in a bit. But I want to talk about the aging veteran. What kinds of health issues do they bring, and especially since you have a specialty in geriatrics,
sure.
What are you seeing?
So, we're seeing the whole spectrum of issues, from people who have many chronic medical problems that are in various stages of degree of severity or disrepair, and a lot of polypharmacy, a lot of people coming through the door on multiple medications because they have a lot of providers, so there's a lot of cooks in the kitchen. And we see, people, some of my favorite patients are they come in and, they're a Purple Heart recipient, and they've done something that was truly unbelievable or tremendous, and they'll never say anything to you unless you ask them. So it's not like they're wearing their courage and what they did for the country on their sleeve, but I look in everybody's record. I want to know everybody's affiliation with the system. And if I identify someone, and if I don't see that a comment or there's something in the record about what their service was, I might ask them, because I'm trying to both build a relationship, but I also kind of know I want to know what they did so that I can thank them more appropriately for their service. And it's an amazing opportunity when that is put in front of you. So, there's a lot of older people, just like anyone would be in the community, and they access multiple points of healthcare in the community as well. So part of what my role is, based upon my expertise and focus, is kind to try to simplify things a little bit and make sure their medicines are playing nicely together, and that they're taking the right ones and the right dosages, and that we're also measuring and observing that they're getting the biggest bang for their buck, in the sense that they're working for them, but also that we're negating any potential side effects or adverse reactions. So those are the kind of benefits that we can offer.
And yet there's also this newer population of veterans,
yep.
who many have come home with diagnoses of post-traumatic stress disorder. Mm-hmm. Some of the things that our veterans of Vietnam, Korea, etc., may have actually had but were never diagnosed.
Truly.
And now the battlefield injuries are the more severe. People can still survive, but you may come back with a traumatic brain injury, a missing part of a limb.
Sure.
How does that pose a challenge for the health professional like yourself?
So, and again, because I'm new to the system, there are many things that I'm able to see now that I was seeing in patients previously, but didn't always have the tools or the support to properly diagnose and to treat. So it makes my job so much easier to be in that setting. In the, it's the obvious injuries. If you lose, God forbid, a limb, you've lost a limb, and if it was a product of your service, obviously that's significant. But when you're involved in a lot of these concussive interventions and a lot of the things that modern warfare has to offer, sometimes they're not as clear physically on people. But if you ask the right questions, and if you spend enough time physically with any veteran who's a patient, they'll tell you what the problem is. And then by virtue of some of our built-in screening requirements, many of which, is just a process, as people are coming back and more of these things are being understood, they're making it more of a routine in terms of our regular evaluation of almost everyone that walks through the door. It's actually quite interesting that you brought that up, because it's not just the recent participants. It's also going back to our World War II veterans, many of which have suffered with some of these emotional and sometimes even psychiatric issues that were just kind of underplayed or underrecognized. And because we have now much regular, robust, and automatic screening built into what we do every day, we're able to tease some of that out. So it actually gives us opportunities to make better interventions.
I mean, some of the issues might have been self-medicated. You might have a high incidence of alcohol-related disease, or people who've either been homeless or have had bad marriages, etc.
Right.
And you have a chance to sort this out now.
Yes, there's a lot of alcoholism, obviously nicotine abuse. There's a lot of both recreational use of pharmaceutical agents as well as recreational use of non-pharmacologic agents. And so, and most of our veterans are very upfront about their habits and their behaviors, because we do query them, we ask them. And it helps, again, open up different avenues and channels for intervention. And if there's an interest on the part of the veteran, we can provide a service to help them. But part of it is that bridge that you have to build, that faith and trust that, we are still the government. And we get that, and, if I offer what we call a telehealth program where you can have, a monitoring device put in your home so that if you're doing blood sugar management or weight and heart pressure, blood pressure management for heart failure or hypertension, but you have to dial into White River Junction, to download the information, people sometimes, I don't want the government in my living room. So there's still a little bit of that going on. But I think that as time goes on, we're finding that because of the way we approach people, they're responding in the way that they need to get better. I think everybody wants to get better.
Obviously, everybody wants to get better. Yeah. Has there been a sea change in the way the VA interrelates with men and women that they treat?
So again, I'm relatively new to the system, so it's very hard to me to speak on a historical perspective, but in the over 20 years that I've been a healthcare provider, I've interacted with the VA system at different levels. And I must say that there's a very robust approach now to gender specific and even non-traditional gender identification concerns and disorders, and it's almost as if we treat everybody equally. But what I'm able to do, which is really, again, something that pleases me to no end, is help people get care who didn't or weren't able to before. So I've had some recent female veterans that have come through the office, and I may have been, in some cases, the first provider to talk to them about psychological, physical, or sexual abuse. And you can almost bet your bottom dollar, if you were a female and you were in the service, somewhere along the line, you had some, at least, access to abuse. And whether it was something that you dealt with on a daily basis, I had one woman say to me, I wasn't raped, so why would I complain? Now, obviously, if you're going to talk about what the ultimate intervention would be in terms of an abuse versus all the other things that can happen to you, depending upon how you interact with other human beings, as a system, we need to be able to address that. And we are doing that. So it, again, gives me great comfort that I can provide that level of care.
And certainly the ability to understand that things will happen to people in military service, and therefore they have an end result on the rest of their lives. The earlier that can be intervened with, the better off we are as a society.
Well, and I think there's no point at which you have that opportunity, but clearly if you don't ask the right questions, if you don't put people in a position to at least address the things that they may or may not recognize about themselves, that you do miss an opportunity.
So, given all of that, how accessible is the Brattleboro office? And do you look to treat people within just the Brattleboro area, or what's your coverage area?
Sure. Well, we have 7 clinics that are affiliated with the White River Junction VA Medical Center, and they're scattered in about probably 100-mile radius between upper Vermont, upper New Hampshire, southwest New Hampshire, and southwest Vermont. So we have a huge catchment area. We have patients that come to us from northern Massachusetts, from southwest New Hampshire, from the mid parts of the state, because we're kind of halfway between here and there. From all the way out east is Wilmington, Halifax, and Windham, and it's very interesting because, again, a lot of what happens to people and what affects their day-to-day lives has a lot to do with where they live and what they do every day. And folks that are out in some pretty rural areas do things that are a lot different than people that live in town sometimes. And it affects how we can deliver healthcare and get services to them, whether or not they're online, on the grid. And, some of those things actually make a big difference.
In fact, a lot of people make their choices depending on how they feel about interaction with others and about their trust of government. So you've got that to break through as well.
Yeah, so I don't have a lot of trappings of government, although I always try to appreciate one of the services by virtue of which ID badge carrier I wear. Yes, we are a government facility. I work for the government, but we are human beings, and everybody that works for me is a mature professional who's been in healthcare for many years, and the sole purpose and reason why they work where we work is because they want to take care of veterans. And that's kind of enjoyable. It's kind of fun to come to work every day.
As the events of some 11 years ago, September 11th, 2001, would tell us, there were people who paid the ultimate sacrifice. Some have served in our military, some just happened to be in the wrong place at the wrong time. So thank you for your ability to treat them.
Well, it's my pleasure. It's my privilege.
So as we wrap up here.
Really? We're done?
Well, close.
It's done. Very quickly, very nicely.
Time flies when you're having fun. Just wait till you get my copay.
Oh, my goodness.
But in case people would like to access this service, run down where you are, the times you may be open,
sure,
and numbers to call where people could possibly get in touch with you.
Right. So we're down by Exit 1 in the Industrial Park here in Brattleboro. We are open 5 days a week. Most days we start at 8:30 in the morning and we're there until 4:30, 5 o'clock at night. But on Tuesdays we actually start later, around 10:30 in the morning, and we're there until almost 7 o'clock at night to kind of have a little bit of a capture for people who have to work during the day. And we appreciate that. But you need to also know that the VA health system is 24/7. So even though you can call our number at 802-251-2200, that was 802-251-2200. If the office is either closed or it's not available, that number will go right up to either White River Junction or our national intake. And the beauty of our system is that our electronic health records follows wherever you go. So they can put in a note and after hours and at our Dayton, Ohio, telephone center, and first thing in the morning I open up my computer if I'm not looking at it at night, and we'll get a message and we'll be all over it. And it's just it's a wonderful system because there aren't too many out there that are like it. If anything, there's nothing out there that's like it. It's the best system that I've ever worked with.
Sounds like you're really enjoying yourself.
I'm having fun and I'm getting paid to do it.
Wow.
What more could you want?
Not sure what else you could want, but I'm glad you're doing this, and glad you're in the area providing health care to people who generally have paid their sacrifice, and now when they need help, you're able to help them.
Yeah, maybe you'll come down and see us sometime.
You never know. Really appreciate the opportunity.
Thank you.
Again, our guest has been Dr. Richard Orlan. He's the medical director of the Comprehensive Care Clinic in Brattleboro, affiliated with the Veterans Administration. Now, if you are an ex-service person or at least have any connection to our nation's military, it would behoove you and behoove those around you to check upon your eligibility, and if there is a medical problem that you're dealing with, even one you may not know about, give them a call, let them know. And after all, you've already paid in full. This is Tim Johnson. Appreciate you watching.